Most people believe walking is a simple, automatic act. We've been doing it since we were toddlers, so we assume we're doing it correctly. But as a physician, I look at walking differently. I see it as a complex series of biological gears. When those gears are aligned, walking is the most powerful anti-aging drug on the planet. When they are misaligned, especially after the age of 50, you are effectively grinding the gears of your heart and joints. The problem isn't the distance you cover, it's the mechanical cost of every step. After 50, your body's repair budget changes. You no longer have the infinite elasticity of youth. Today, I'm breaking down the 7 mechanical failures that are sabotaging your health and the precise biological resets you need to turn your daily walk into a longevity protocol. The first mechanical failure starts the moment you step out the door. Most walkers treat their heart like a light switch. They flip it from off to on instantly. This creates a surge in arterial pressure before your blood vessels have had time to dilate. In your 50s and 60s, your vascular walls are less flexible than they used to be. A sudden, cold start forces the heart to work harder against stiff resistance. Think of your heart as a high-performance engine that needs to reach operating temperature. Start with a 5-minute slow, easy stroll. This triggers the release of nitric oxide in your blood vessels, which relaxes the arteries and prepares them for the increased flow of a brisk walk. One of the most visible mistakes I see is the structural lean. As we age, gravity and modern habits pull our shoulders forward. When you walk with a rounded upper back, often from looking down at a phone or the pavement, you are physically compressing your diaphragm. Your lungs cannot expand downward into the abdominal cavity. This leads to shallow chest breathing, which triggers the stress response in your nervous system. You end up feeling tired and winded, not because you're out of shape, but because you are suffocating your own progress. Imagine your ribcage is a bellows. Lift your sternum toward the sky. This opens the oxygen gate, allowing deep diaphragmatic breathing that fuels your muscles and keeps your heart rate stable. We often think that if a shoe looks clean and the tread is intact, the shoe is fine. This is a dangerous medical assumption. The internal foam of a walking shoe has a compression life. Once that foam dies, the shoe no longer absorbs the echo of your step. Every time your heel hits the ground, a shock wave travels upward. If the shoe doesn't catch it, your ankle catches it. If the ankle is stiff, the knee catches it. If the knee is weak, the lower back catches it. Do not wait for holes to appear in your shoes. If you are over 50 and walking daily, your internal dampening system needs help. Replace your footwear every 4 months to ensure your joints aren't absorbing the impact that the foam should be taking. There is a common belief that one long, grueling walk on the weekend makes up for a sedentary week. Biologically, this is false. Your insulin receptors and metabolic markers operate on a 24-hour rhythm. A weekend warrior approach creates a massive spike in inflammation without the daily cleaning of the metabolic pathways. Your body needs a daily dose. A 20-minute walk every single morning is medically superior to a 3-hour hike once a week. Consistency keeps the metabolic fire burning and prevents the joint stiffness that sets in during long periods of inactivity. If you walk with your arms glued to your sides or tucked into your pockets, you are fighting your own physics. Your arms and legs are designed to work in an X pattern to stabilize your spine. When the arms are still, the torso must rotate more to compensate. This puts unnecessary torque on the lumbar discs of your lower back. Let your arms act as the pendulums they are. A natural 90-degree bend at the elbow reduces the weight on your legs and creates a rhythmic pump that improves total body circulation. Walking with your mind buried in a podcast or a screen creates a brain-body disconnect. After 50, our ability to sense our position in space, known as proprioception, is a skill that must be maintained. When you aren't focused on the terrain, your stabilizing muscles around your ankles and core stop firing as efficiently.
This is why most mysterious falls happen on flat ground. Practice active walking. For at least 10 minutes of your walk, focus entirely on the sensation of your feet hitting the ground and the rhythm of your breath. This neurological sharpening protects your balance as much as your muscles. The final mistake happens after the walk is over. Many seniors finish their walk, sit down, and forget to rehydrate. Your fascia, the connective tissue surrounding your muscles, is like a sponge. When it's hydrated, it's slippery and flexible. When it's dry, it's sticky and stiff. That stiffness you feel the hour after a walk isn't usually muscle damage. It's dehydrated fascia. Drink 10 ounces of water with a pinch of sea salt or electrolytes immediately after returning. This flushes the metabolic waste out of the tissues and prevents the post-walk freeze that makes you feel older than you are.
Walking is the most accessible medical intervention we have. It doesn't require a prescription, but it does require precision. When you stop just walking and start following a kinetic protocol, you change the way your body ages. When we talk about walking after 50, we are really talking about the preservation of the mitochondrial engine. Inside every cell of your body, you have small power plants called mitochondria. As we age, these power plants can become less efficient, leading to what we call cellular fatigue. Walking, when done correctly, is one of the few activities that signals your body to undergo mitochondrial biogenesis, the creation of new, healthy power plants. This is why the cold start error is so damaging. If you spike your heart rate too fast, you force the body into anaerobic metabolism, which creates high levels of lactic acid and oxidative stress. By using the comfort ramp protocol, you stay in the aerobic zone, which cleanses the cells rather than stressing them. Let's look deeper at the posture we discussed. When the head is forward, you are also compressing the vagus nerve. The vagus nerve is the superhighway of the parasympathetic nervous system, your rest and digest system. A compressed vagus nerve sends a signal of panic to the brain. This is why some people feel anxious or on edge during their exercise. By standing tall and opening the sternum, you release the pressure on this nerve. Suddenly, walking becomes a meditative act. You aren't just moving your legs, you are calming your brain. This neurological reset is a primary reason why walking is linked to a 30% reduction in dementia risk. The footwear issue also goes beyond just cushioning. It's about the kinetic gait. Your feet have thousands of nerve endings that provide feedback to the brain about the surface you are on. If your shoes are too rigid or too worn, your brain receives noisy data. To compensate, the brain stiffens the muscles in your calves and thighs to protect the joints. This stiffness is what leads to the feeling of heavy legs. When you wear shoes with the correct compression life, your brain feels safe, your muscles relax, and your stride becomes fluid. Regarding the metabolic shift, we must discuss the postprandial spike. Walking is the most effective way to clear sugar from the blood after a meal. When you walk, your muscles act like a sponge for glucose, even without the need for high levels of insulin. For those over 50 managing insulin resistance, a 5-minute walk after lunch is more effective than many medications. The weekend warrior ignores this daily opportunity for blood sugar management, allowing high glucose levels to damage the lining of the arteries for 6 days out of 7. The arm movement style also has a hidden cost: lymphatic drainage. Unlike your cardiovascular system, which has a heart to pump blood, your lymphatic system, your body's waste disposal, has no pump. It relies on the movement of your muscles and joints. The swinging of the arms and the rotation of the torso act as the pump for the lymph nodes in your armpits and chest. When you walk with still arms, you are leaving your waste disposal system in park. Finally, consider the proprioceptive disconnect. The brain is a use it or lose it organ. If you don't challenge your balance and your awareness of the ground, the neural pathways for stability begin to prune away. By practicing active walking and focusing on the sensation of each step, you are performing a form of neurological physical therapy. This prevents the shuffling gait often associated with aging and keeps your movement patterns youthful and confident. I want to know your routine. Do you walk in the morning light or the evening cool? Tell me in the comments. I use your feedback to shape our future protocols. If you're ready to take control of your biology, subscribe to the Dr. George Whitaker channel. Your health isn't a destination, it's the path you walk every single day. Make sure it's the right one. Next, you need to watch our video on the surprising effects of nutrition on your longevity. Your health is built through these small daily choices. Stay proactive, stay informed, and most importantly, stay moving. I'll see you on the path.